Thank you for watching Tomorrow's Consciousness. This is Prescribing Joy. Can public health write prescriptions for fun? I'm Rukia. Pause right now. Write down one activity that reliably makes you smile. That's your personal prescription for joy. Tape it somewhere visible. What if your doctor prescribed laughter instead of pills? Let's reframe joy, not as a luxury, but as prevention. When we embed creativity, movement, and connection into our systems, we're not just making life more pleasant, we're building resilience, health, and hope. Leaders at every level must fight for systems where joy is as essential as medicine. That's holistic leadership, seeing the whole person and designing for wholeness. True systems leadership means seeing health not just as the absence of disease, but the presence of well-being. Holistic leadership means fighting for systems where joy is as essential as medicine. It's not just about treating illness, it's about cultivating well-being. So here's your challenge for the week. Write yourself a prescription for joy and fill it. Maybe it's a walk in the park, a dance class, or a call to a friend. Notice how it changes your body, your mood, your health. Share your experience with us or simply reflect on it privately. Remember, joy is not a luxury. It's a vital sign. And together, we can build systems where everyone has access to it. The UK National Health Service now funds social prescribing nationwide. Across the country, doctors can formally refer patients to community activities, gardening, choirs, art classes, just like they would prescribe medication. This is a bold move, recognizing that health is more than just medicine. The next frontier in the United States, insurance reimbursement for social prescriptions. Imagine a future where your health plan covers not just pills, but also a pottery class or a walking group. Some pilot programs are already paving the way, but there's a long road ahead. But here's an equity reminder. Without intentional design, joy becomes a luxury for the privileged. If social prescribing isn't accessible to everyone, it risks widening the gap between those with resources and those without. True health equity means making joy available to all. If we can prescribe insulin, we can prescribe instruments. Link? The future of health is creative, inclusive, and joyful if we choose to design it that way. Let's pause for a moment. If your doctor wrote you a prescription for fun, what would be on it? A dance class? A book club? Time to paint? Take a moment and imagine that prescription in your hands. What would bring you the most joy? Is it movement, creativity, or connection? If you'd like, please share your answer with us on social media or reflect on it privately. Now let's imagine you're a public health commissioner with the power to fund just one program for your city. Option 1, expand the city's diabetes clinic, providing more medical care for those in need. Option 2, launch a citywide Prescribe Joy initiative, reaching 100,000 residents with programs for art, movement, and connection. Which do you choose and why? There's no easy answer, but your choice shapes the future of health. In Japan, the concept of ikigai, a reason for being, is woven into the fabric of health and longevity. In Okinawa, people live longer, healthier lives, not just because of diet or medicine, but because of strong social ties and a deep sense of purpose. Community, belonging, and joy are seen as essential nutrients for a long life. Across Latin America, plazas and community festivals are more than just celebrations. They are preventive health in action. These vibrant gatherings foster connection, movement, and joy, acting as a social prescription for well-being. In the United States, social prescribing is gaining ground. Pilot programs in New York and California are connecting patients to art classes, walking groups, and community gardens. These initiatives are showing that health is about more than medicine. It's about connection. The science of fun is ancient. We just forgot it. Around the world, cultures have always known that joy, community, and celebration are vital to health. Today, we are simply rediscovering what our ancestors practiced every day. AI is now piloting joy prescriptions. In clinics across the world, artificial intelligence is helping doctors recommend not just medicine, but moments of happiness. Apps now track your mood and, based on your patterns, Recommend art classes, sports groups, or meditation circles. Imagine your phone nudging you toward joy. In the UK, AI is helping physicians match patients with community resources, choirs, walking groups, even gardening clubs. The algorithm will see you now. Soft, upbeat music rises. But here's an equity caution. Algorithms might overprescribe joy to urban populations with resources, while rural or marginalized communities remain invisible. If joy isn't in the data set, joy won't be in the prescription. Let's start with a sobering fact. The World Health Organization notes that loneliness increases mortality risk by 26%. That's right, loneliness can be as deadly as many chronic diseases. And it's not just a global issue. In the United States, nearly half of adults report feeling isolated. That's millions of people, friends, neighbors, maybe even you or me, struggling with disconnection. If we treat isolation as a public health epidemic, then connection itself becomes medicine. Imagine a world where the prescription isn't just for pills, but for belonging. Here's a surprise. We don't just get sick from pathogens. We get sick from disconnection. What? Our bodies and minds crave community as much as they crave food or water. So what does systems leadership mean in this context? It means asking not just how do we treat disease, but how do we design joy into the fabric of public health? It's about reimagining our systems to prioritize connection, belonging, and joy as essential to our well-being. Picture this. A middle-aged man in London goes to his GP for depression. Then, instead of only prescribing medication, his doctor writes something unexpected, a referral to a community choir. Within weeks, his symptoms ease, not just because of singing, but because of belonging. This is called social prescribing, and it's more than a feel-good experiment. It's data-backed, policy-tested, and it's changing how we think about health. What if your doctor prescribed laughter instead of pills? No? What if your public health system could write a prescription for joy? The algorithm will see you now. Welcome to Tomorrow's Consciousness. I'm your host, Rukia. Today's episode asks a radical question. Can public health write prescriptions for fun? But before we dive in, a quick note. The views expressed on Tomorrow's Consciousness are for informational purposes only. They're not medical advice or professional guidance. Always consult a qualified expert for your own care. And remember, some opinions shared here belong to our guests and may not reflect my own. By listening, you acknowledge we're not liable for decisions you make based on this content. Now follow. What if your doctor's next prescription wasn't for a pill you swallow? What if instead of a chemical compound, they prescribed a connection? Imagine leaving the clinic with a referral not to a pharmacy, but to a community choir, or a gardening club, or a dance class. This isn't a scene from a utopian novel. It's happening right now. In places like the United Kingdom, Canada, and Japan, a quiet revolution is taking place in healthcare. But why does joy matter in public health at all? To answer that, let's zoom out. Loneliness isn't just a private ache, it's a public health crisis. Research shows chronic loneliness can be as harmful as smoking 15 cigarettes a day. It raises our risk of heart disease, dementia, and even early death. And yet the antidote isn't always a pill, it's connection. We don't just get sick from pathogens, we get sick from disconnection. When people feel genuinely seen, heard, and included, they heal faster and live longer. Systems leaders in health, doctors, policymakers, community organizers are waking up to this truth. They're asking, what if we designed healthcare not only to treat illness, but to cultivate joy and belong? Imagine a world where public health systems prioritize connection as much as cure, and where fun is seen as fundamental to well-being. This isn't just wishful thinking. Studies show communities with strong social bonds are more resilient in the face of crisis. People who feel connected to others recover faster from surgery, cope better with stress, and even have stronger immune systems. So when we talk about prescribing joy, we're not just talking about feeling good, we're talking about saving lives. Let's explore how this revolution is unfolding and why reimagining joy could be the most powerful medicine of all. Enter the age of algorithms. What happens when technology teams up with joy? Across the UK, doctors are piloting a new approach, AI-driven joy prescriptions. Here's how it works. Patients fill out mood tracking apps that use smart algorithms to recommend activities proven to boost happiness, gardening clubs, dance classes. These digital tools don't just guess what might help. They learn from each user's preferences and progress, making joy personal and precise. But there's more. These AI-powered systems are being tested everywhere. Busy London clinics, rural communities, aiming to make joyful activities accessible for everyone, not just those with time, money, tech savvy. The goal? Equity and happiness. Of course, there's a catch. Experts warn that we need to be careful. Algorithms can reflect the biases of the people who build them. If we're not vigilant, technology could leave some people out or even make loneliness worse. As one UK project leader put it, joy should never be a privilege. It's a prescription for all. So can technology really help us rediscover joy? Early results are promising, but the real test is whether these digital solutions can build bridges instead of barriers. If joy isn't in the data set, joy won't be in the prescription. In the next section, we'll explore what it means to rethink sadness and why connection might be the most powerful medicine of all. This new approach asks a radical question. Is the solution to our sadness always something to be found inside a bottle? For decades, we have been told a story that depression and anxiety are simply a chemical imbalance in the head, a glitch in the hardware. And for many people, antidepressants have been a crucial lifeline. I know this myself. But what if that story is incomplete? What if the problem isn't just in our skulls, but in our societies? We are the loneliest humans that have ever lived. We have been disconnected from meaningful work, from other people, from nature, and from a hopeful future. The Doctors Prescribing Fund are acknowledging this deep disconnection. Podcast explores how AI and technology are transforming social prescribing, connecting people to art, movement, community, and creativity. This podcast ties together technology, culture, and healthcare, showing how AI can help doctors and patients find meaningful, joyful activities beyond traditional medicine. They see the wound and they are trying to heal it. Think about the last time you felt truly, deeply happy. Or was it when you were lost in a moment with others? Maybe you were laughing with friends, or singing along at a concert, or working together on a project you cared about. These moments are not just pleasant distractions. They are essential nutrients for our mental health. They are the vitamins of the soul. We have been systematically deprived of these nutrients. Our culture tells us to buy more things to climb the ladder to be individual achievers, but it has forgotten to tell us how to be together. This new medical movement is a rediscovery of that forgotten wisdom. So when a doctor in Shetland, Scotland, prescribes a nature prescription for a patient to go birdwatching, they are doing something profound. They are not just treating a symptom, they are treating the root cause. They are saying, your pain is real, but the solution might not be to numb it. The solution might be to reconnect you to something meaningful, to something real. Now let's step into the engagement and leadership lab. Imagine you're not just a listener. You're the leader of your own well-being. Picture this. You're in a small community. Maybe it's your neighborhood, your workplace, or even your online group. Someone you know is feeling isolated, disconnected, maybe even a little down. Here's your interactive scenario. If you could write a prescription for joy, not a pill, but an experience, for this person, what would you choose? Would you invite them to join a community garden? Start a book club? Organize a weekend hike? Or maybe just share a cup of tea in a heartfelt conversation? Pause for a moment. What would your prescription be? And just as importantly, how would you lead by example? Would you be the first to show up, to greet others, to make space for laughter and connection? This is the heart of social health, not waiting for someone else to make the first move, but stepping up as a leader in your own life and community. When you take initiative, you plant seeds of joy that can blossom for everyone around you. So, what will your prescription for joy be today? Drop your ideas in the comments, and let's inspire each other to lead with kindness, creativity, and courage. Ready to see how this idea is transforming healthcare? Let's explore what social prescribing really means. Before we dive into the official world of social prescribing, let's take a detour into pop culture, unexpected science, and a touch of technology. First stop, Pixar's Inside Out. Remember the character Joy? She wasn't just a bubbly emotion. She was a leader, guiding Riley through life's ups and downs. The film reminds us, joy and sadness can work together. Sometimes sharing a laugh or a memory can be the best medicine. And yes, even animated characters can teach us about the power of emotional health. Pop culture curveball. The Beatles once sang about Dr. Robert, a physician with a special prescription for happiness. Maybe a little ahead of his time. And if public health had an anthem, Pharrell's Happy would be it. Imagine doctors everywhere writing a prescription for dancing in your living room. Just like Pharrell says, clap along if you feel like happiness is the truth. Sometimes the best medicine is a song stuck in you. Now let's step away from the screen and into the real world, where laughter is literally a prescription. Enter laughter yoga. It's exactly what it sounds like. Groups of people gathering to laugh, intentional. No jokes required. Science shows that shared laughter reduces stress hormones and boosts mood-boosting chemicals. It's social, it's silly, and yes, it works. But what about technology? Here's a surprise. Some mental health platforms and AI chatbots now prescribe joy. They might suggest a funny video, a daily gratitude prompt, or even a digital joke of the day. These aren't just gimmicks. They're modern tools helping people reconnect with positive emotions, even if it's just a smile at a screen. So whether it's a Pixar film, a laughter yoga session, or an AI chatbot reminding you to take a joy break, these are all ways we're weaving joy back into health. Sometimes the best prescription isn't a pill. It's a moment of connection, a burst of laughter, or a gentle nudge from technology to remember. Joy is essential, and it's everywhere, if we know where to look. So what do we call this radical idea? It has a name. It's called social prescribing. Sounds a bit clinical, a bit dry, but what it means is beautiful. It is the practice of connecting patients to non-medical support within their community. It's a way for doctors to formally refer people. It's a way for healthcare workers to formally refer people. It is a bridge from the sterile environment of a doctor's office to the vibrant, messy, healing world of human community. It is a recognition that health is not just the absence of disease. Health is about being connected. It's about having a reason to get out of bed in the morning. The menu of options is as varied as human interests. For one person, the prescription might be to join a walking group. The gentle exercise is good for the body, yes, but the real medicine is the conversation along the way. It's the shared experience of watching the seasons change. For another person, it might be an art class. The act of creating something with your hands, of painting or molding clay, can quiet a racing mind. For me, the prescription is tailored to the person. It meets them where they are. Other examples are even more direct in their aim to build community. A doctor might prescribe volunteering at a local animal shelter, or joining a community garden where people work side by side to grow food, or even a men's shed, men gathering to work on practical projects together. In these spaces, the activity itself is almost secondary. The main purpose is to create a sense of belonging. A place where you are needed, a place where you are known, a place where people will notice if you don't show up. This isn't about replacing traditional medicine. It's about enhancing it. It's about adding more tools to the doctor's toolkit. A patient might still need medication for their high blood pressure, but joining a healthy cooking class prescribed by their doctor can help them make lifestyle changes that medication alone cannot. A person with deep depression might find antidepressants give them the initial lift they need to leave the house. But it's the social prescription, the weekly choir practice, the pottery class that gives them a reason to do so. Social prescribing builds a scaffold of support around a person, helping them to rebuild their life, not just manage their symptoms. Now, you might be thinking this all sounds wonderful, but also complicated. How does a busy doctor, with only 10 minutes per patient, know about every local choir, gardening club, dance class? How can they possibly match the right person to the right activity? This is where something we often see as disconnecting, technology, can become a powerful tool for connection. Artificial intelligence, or AI, is emerging as a crucial partner in the social prescribing revolution. It can act as a sophisticated hyperlocal matchmaker, connecting people to the joy they so desperately need. It can be the digital link worker that guides people to their tribe. Imagine an AI system integrated into a clinic's electronic health records. A doctor talks to a patient who is feeling isolated and listless. The doctor inputs a few key details: the patient's interests, mobility level, location, and feelings of anxiety. The AI scans a vast, constantly updated database of community resources. It's not just a simple search engine. It's smarter than that. It cross-references the patient's needs with the specific benefits of each activity. It might know, for example, a Tai Chi group is welcoming to beginners, or that a book club meets in a wheelchair-accessible building. This technology can overcome big hurdles in social prescribing. One main challenge is awareness. Patients and doctors often don't know what's available just around the corner. An AI-powered platform can create a living map of community assets. It reveals where pockets of joy and connection are hidden. This all sounds nice, you might say. But where's the evidence? Does joining a choir really change your biology? The answer overwhelmingly is yes. The science of how joy, connection, purpose affect our physical and mental health is robust and growing every day. This isn't wishful thinking, it's hard science. For a long time, we have known about the destructive power of loneliness. A landmark study found that loneliness is as damaging to our health as smoking 15 cigarettes a day. The UK government estimated that loneliness cost the country's employers £2.5 billion every year through sickness and lost productivity. Loneliness isn't just a sad feeling, it's a public health crisis. So how does connection heal us? Let's look at the stress hormone, cortisol. When we are chronically stressed or lonely, our cortisol levels are persistently high. This state of constant fight or flight is devastating for our bodies. It suppresses our immune system, it increases inflammation, it raises our risk of heart disease, it raises our risk of diabetes, it raises our risk of dementia. But when we engage in joyful group activities, something remarkable happens. Studies have shown that singing in a choir, for example, can significantly lower cortisol levels. More than that, it can increase levels of immunoglobulin A, an antibody that is our body's first line of defense against infection. Singing together literally makes our immune system stronger. It's not just about stress hormones, it's also about our brain's own natural feel-good chemicals. When we dance, sing, or even just laugh with others, our brains release a cocktail of neurochemicals. Endorphins, our body's natural painkillers. This is the runner's high, but you can get it from a group salsa class too. Oxytocin, the bonding hormone, which promotes feelings of trust and social connection. Dopamine, the neurotransmitter of reward and motivation. These chemicals don't just make us feel good in the moment, they actively counteract the brain patterns associated with depression and anxiety. They help to rewire our brains for happiness. The physical health benefits are just as striking. One study published in the British Medical Journal followed a group of people who were prescribed visits to an art museum. The participants reported significant reductions in anxiety and depression, but also in chronic pain. Similarly, group walking programs have been shown to lower blood pressure, improve cardiovascular health, and help manage weight, all while combating social isolation. Here's a community voice. Before joining the art group, I felt invisible. Now I have friends who check in on me every week. That's the power of social prescribing. The evidence is clear. Joy is not a luxury. It is a biological necessity. The idea that community and shared celebration are essential for health is not new. In fact, it is ancient wisdom. For most of human history, we lived in close-knit tribes and villages. We hunted together, we ate together, we sang together, we danced together. Our survival depended on it. The modern concept of social prescribing is, in many ways, the rediscovery of what our ancestors always knew. It is an attempt to rebuild the village that we have lost. Many cultures around the world have kept this wisdom alive, weaving it into the fabric of their daily lives. We in the West have much to learn from. Consider the concept of ikigai in Japan, particularly in Okinawa, a region famous for its longevity. Ikigai is often translated as a reason for being. It is the intersection of what you love, what you are good at, what the world needs, what you can be paid for. But it's more than a career path. It is a deep sense of purpose that gets Okinawans out of bed in the morning. Crucially, ikigai is often found in service to the community. Across the globe, the science of joy is less of a new discovery and more of a long-lost memory. In Japan, ikigai gives people a reason to wake up each day. It's also about gathering, creating, and contributing together. In the heart of Latin America, city plazas come alive with music, food, and laughter. Public spaces designed for spontaneous festivals. These aren't just parties, they're intentional rituals that bind communities and boost collective well-being. Meanwhile, in the United States, cities like New York and San Francisco are piloting programs that prescribe museum visits, gardening groups, or dance classes instead of pills. These initiatives are inspired by ancient wisdom, but powered by modern science, showing measurable improvements in mental and physical health. What connects all these places? The understanding that joy, connection, and play are not frivolous extras. They're fundamental to thriving. The science of fun is ancient. We just forgot how to use it. Okinawans also have moai, small groups of friends who support each other for life, both socially and financially. A moai is a pre-made social safety net. It is social prescribing, built into the culture itself. Or look to the concept of Ubuntu in Southern Africa. It is a philosophy often summarized by the phrase, "I am because we are." It means that a person's humanity is inextricably bound up in the humanity of others. Your well-being is tied to my well-being. This worldview places community at the absolute center of life. Healing, in an Ubuntu context, is never just an individual process. When someone is sick or suffering, the community rallies around them. They are brought back into the fold through ritual. They are brought back into the fold through storytelling. They are brought back into the fold through shared meals. We see this wisdom in so many other traditions. In the vibrant street festivals of Latin America, in the Irish tradition of the Sidi, even in the simple act of sharing food, which reinforces connections and reaffirms that no one should be left to eat alone. These are not just quaint customs. They are powerful, time-tested technologies for promoting collective mental and physical health. They are the original prescriptions for joy. We have just forgotten how to write them. The global movement to prescribe joy is filled with wonderful, surprising, and heartwarming details. It shows us that creativity in healthcare knows no bounds. For instance, did you know in some parts of Canada, doctors can now prescribe a parks pass? That's right. Anxiety, depression, other conditions can qualify for a free pass to the country's national parks. The prescription acknowledges nature's healing power, ecotherapy. A dose of awe, fresh air, and green space can be as effective as medication for some patients. Imagine being prescribed a hike to a beautiful lake. The creativity doesn't stop with nature. In Belgium, doctors are prescribing museum visits. In a Brussels pilot project, patients with burnout, other stress-related conditions can get free trips to major museums. Immersing in art and history can break the narrow, stressful focus of modern life. It pulls you out of your own head and connects you to human creativity and experience. It's a prescription for perspective. In the United Kingdom, social prescribing is advanced and diverse. One popular prescription, bibliotherapy. A doctor or link worker can prescribe specific books, novels, poetry, self-help guides. Libraries offer curated reading well lists for conditions like dementia, grief. Reading a story can make us feel less alone. It connects us to characters facing similar struggles, offering escape and understanding. It opens new worlds without your chair. One charming example, animals. Animal-assisted therapy is prescribable in many places. Volunteering at a shelter, reading to therapy dogs. The non-judgmental affection of an animal profoundly helps well-being. It lowers blood pressure, reduces anxiety, combats loneliness. Fun fact, petting a dog for minutes can boost oxytocin, serotonin. But how do these joyful prescriptions move beyond a handful of creative doctors and become part of everyday healthcare? Let's take a closer look at how policies are making joy a standard part of care, not just a lucky exception. In the United Kingdom, the National Health Service has woven social prescribing into its official strategy. Thousands of link workers now help patients access community groups, arts programs, gardening clubs, and more. right from their doctor's office. It's not just a recommendation, it's a funded, supported pathway to better well-being. And early research shows it's working. Patients report less loneliness, fewer GP visits, and a renewed sense of purpose. Across the Atlantic, the movement is catching on in the United States too. Some insurance companies are beginning to cover programs like art therapy, group exercise, mindfulness classes as part of mental health benefits. The goal? Prevent illness, not just treat it, and address the root causes of stress and isolation before they turn into costly health crises. But these solutions must reach everyone. Equity matters. Policymakers and advocates are pushing for expanded access. So joy isn't only prescribed to those who can afford it, but is a basic right, built into public health for all. Here's a sticky quote to remember. A prescription for joy is a prescription for justice. When we design health systems that value happiness, connection, and creativity, we're not just treating symptoms. We're building a healthier, fairer world. No revolution comes without skeptics, and the movement to prescribe joy is no exception. Some critics argue that social prescribing is just a soft policy, a feel-good distraction from the hard realities of medicine. They ask, is this really healthcare or just another passing trend? Insurance companies, budget-conscious policymakers, will these programs really save money or simply add cost to already stretched systems? Can art classes truly substitute for proven medical interventions? Can community gardens truly substitute for proven medical interventions? And what about accountability? How do we measure success when the prescription is laughter or belonging, not a pill or a procedure? Let's look at the evidence. Studies in the UK show that patients referred to social prescribing programs visit the emergency room less often and require fewer costly medications. One NHS review found a 28% reduction in primary care visits among patients who received a joy prescription. In the US, pilot programs are reporting improved mental health outcomes, lower stress, and even higher rates of return to work. Critics worry about soft metrics, but the data is getting firmer every year. Joy prescriptions don't replace traditional medicine. They complement it. They address root causes, like loneliness and chronic stress, that no pill can fix alone. And by reducing the need for expensive treatments, they help make the whole system more sustainable. Balanced, systems-level thinking means asking hard questions and following the evidence wherever it leads. Right now, the evidence is clear. Joy isn't just a luxury. It's a smart, science-backed investment in healthier people and healthier communities. Let's follow the money. Behind every new idea in healthcare, there's one question that makes or breaks it. Does it pay off? Social prescribing, whether it's art therapy, community gardening, laughter, yoga, might sound warm and fuzzy. But can it deliver real returns on investment? Here's what the numbers say. In the UK, for every pound invested in social prescribing, the NHS has seen up to £3 saved, reduced emergency room visits, less reliance on expensive medications. In Canada, pilot programs report a drop in hospital admissions, a boost in patient satisfaction, translating to millions saved each year. Insurance companies are starting to take notice. Some are now covering programs that focus on connection and well-being, betting that healthier, happier members will file fewer claims in the long run. But ROI isn't just about dollars. It's about value. Fewer missed workdays, stronger communities, less burnout among healthcare workers. When people feel supported and joyful, they're more likely to stay well, stay employed, and contribute to society. Of course, not every program is a financial slam dunk. Measuring the economic impact of joy is still a new science, but early results are promising. The bottom line, social prescribing isn't just good for the soul. It's looking pretty good for the spreadsheet, too. Policy Hack Spotlight. Bold ideas are reshaping public health. In some cities, insurance now covers museum tickets as a prescription for well-being. Other cities fund dance programs right in clinics, bringing movement and joy to patients. And tech companies are using AI to identify community joy deserts, places lacking opportunities for fun and connection, so resources can be targeted where they're needed most. So we stand at a crossroads in how we think about health and healing. For a century, medicine has been focused on the body as a machine. If a part is broken, we fix it or replace it. If there's a chemical imbalance, we correct it with another chemical. This model has given us incredible gifts: antibiotics, vaccines, surgeries that have saved countless lives. But it has left a huge part of the human experience out of the equation. It has forgotten about the soul. It has forgotten about our deep, innate, and biological need for connection, for meaning, and for joy. The joy revolution is about remembering. The future of health is not about choosing between a pill and a pottery class. It is about embracing both. It's about creating a holistic, integrated system of care that sees the whole person. A system that understands that a human being is not a collection of symptoms, but a complex being with physical, emotional, and social needs. Prescribing fun is not a soft or alternative approach. It is a science-based, evidence-backed intervention that addresses the root causes of so much of our modern suffering. It is a recognition that you can't medicate away a life that lacks purpose. You can't drug away the pain of profound loneliness. This movement gives us a more hopeful story about our pain. The old story told us our depression and anxiety were a sign of a defect, a weakness in our own brain chemistry. The new story says that these feelings are not a malfunction. They are a signal. They are a form of grief for the connections we have lost. Ultimately, the joy revolution is about reclaiming a fundamental human right, the right to a happy and connected life. It's a movement that says that health is more than the absence of sickness. It is the presence of vitality. It is about building a world where it is easier for people to find each other, where our communities are rich with opportunities for connection, where a doctor's first question isn't just, where does it hurt, but also, what brings you joy? Think the best healthcare of the future won't just add years to our life, it will add life to our years. And that is a future worth being joyful about. Let's talk pop culture. Remember Pixar's Inside Out? That film showed us joy isn't just a feeling, it's a core driver of health. What if our healthcare system took that lesson seriously? Here's a fun fact. Laughter yoga has been shown to lower cortisol and blood pressure. Yes, laughing on purpose is actually good for your heart. Turns out dad jokes might be preventive medicine. Maybe your next prescription will be a daily dose of puns. Here's the twist. AI chatbots now prescribe breathing exercises and playlists. Machines prescribing joy? The algorithm will see you now. Thank you for joining us on Tomorrow's Consciousness. This was Prescribing Joy. Can public health write prescriptions for fun? I'm Rukia, and it's been a pleasure exploring the science and soul of happiness with you. As we close, take a moment to reflect. What will your prescription for joy look like tomorrow? Maybe it's a walk with a friend. Maybe it's a new song. Maybe it's a moment of laughter. Remember, even in a world shaped by algorithms, your joy is unique and essential. If today's episode sparked a smile, share it with someone who could use a little more joy. And don't forget, the algorithm will see you now, but it's your heart that writes the script. Until next time, stay curious, stay joyful, and keep prescribing happiness. Wait. One last thing. Not everyone is convinced. Some critics argue that prescribing joy is just a soft policy, more about good feelings than real results. They question whether insurers or policymakers will see these programs as frivolous or even a distraction from more serious healthcare priorities. But the evidence tells a different story. Studies show that social prescribing can lower emergency room visits, reduce medication costs, and improve mental health outcomes. These are real, measurable benefits that matter to both patients and the healthcare system. By considering both the critiques and the evidence, we show what it means to be a balanced, systems-level thinker. True leadership means weighing all perspectives and choosing what works best for the health of our communities. Let's follow the money trail. A study in the UK found that for every dollar invested in social prescribing, the return can be $3 to $4 in reduced healthcare costs. That's a powerful argument for joy as a public health investment. Joy isn't just feel good, it's fiscally smart. Thank you for watching Tomorrow's Consciousness. This is Prescribing Joy. Can public health write prescriptions for fun? I'm Ruchia, and remember, the algorithm will see you next.